My name's Luis. I'm 43 years old. I was an independent business owner, which I incorporated in 2001. I grew my business tremendously over the course of the next 8 years. April 19th of 2009, I was involved in a very serious motorcycle accident. Through no fault of my own, I impacted the rear of a truck and a trailer, probably doing about 45 to 50 miles an hour with no helmet on. The whole right side of my face and head was crushed. It is now made of titanium. I have 2 titanium collarbones. I have a stainless steel wrist. On the helicopter flight to the hospital, I stopped breathing twice. I had to be resuscitated. I spent the next 3 days in a coma and 8 days in ICU. I would say for about 2.5, almost 3 years prior to my accident, I was on a program. And the program basically included weightlifting, prescribed nutritional aspects to benefit my diet. I was on testosterone and I was on human growth hormone. At the time of the accident, my levels were very good to high. Like I said earlier, I was feeling probably better than I ever had in my life. As I laid in bed in ICU within a few days after the accident, I had tremendous wounds to my face, head, and torso. The doctors did notice that within days, 3 to 4 days, my wounds were healing dramatically faster than what they had seen before. I had a neurologist, an optometrist, an orthopedic surgeon, a facial reconstructive surgeon, and a doctor for the Center for Disease Control because of the infections I encountered. Well, here we are about a year, almost a year and a half later, and the only doctor I see now is my general practitioner. I have had no follow-up with any of the other doctors other than the optometrist I've seen twice just to check my eyes, which definitely have decreased since the accident. I've got no prescribed aftercare other than medication to help me with the pain.
Prior to Luis's accident, we had him on the program and we actually had a roadmap of his physiology, nutritionally and hormonally. Now we have to develop a treatment protocol for him. We're sort of like dropped into the second act of a third act play. We're providing a service that traditional medicine isn't providing. We're looking at multiple metabolic systems. We're looking at all his hormone levels. And we're looking at an area called brain plasticity. We want to be able to help him develop new brain tissue, which is what the latest research is showing us now that can be done. And the only way that can be done is to look at multiple metabolic systems of his body and track that over the next 12 months. And we've got some of his test results back, and it's showing us obviously that his brain chemistry is a little out of balance and he's low in serotonin and dopamine, as he has mentioned. But instead of just medicating him with the symptoms, we want to sort of go after the cause of this. We want to monitor his cortisol levels because with his change in lifestyle right now from where he was to where he is now, it elevates cortisol and that damages multiple systems of the body. When he's under stress, he could be shutting down the whole process. So there's multiple pieces of the puzzle that we have to pull together for Luis, and when we do that, we're going to be able to help a lot of other people with the same condition, including the troops coming home with brain injuries.